Okay, I'm going to demonstrate how to put on and how to take off your personal protective equipment. This always begins with hand hygiene. So use your alcohol-based hand rub. It should take at least 15 seconds or so to completely rub in and dry. Okay, and then you're going to begin to put on your PPE. And you're going to begin with your gown. So I've got a paper gown here. Slide that on. And then you want to make sure that the gown is tied in the back so it doesn't accidentally slip off during the provision of patient care. Okay, so gown is on, and then we'll go ahead and put on the mask. Okay, so you get your mask on behind the ears. There's different types of masks out there. You want to make sure it's secure around your nose and around your cheeks. The next step I will show is putting on goggles, if you're going to wear goggles. And very simply, put these on with the elastic strap in the back. I also want to call your attention to, in some cases, you may use a face mask with eye protection or with eye protection built in. This is another option out there that you may use, and this would be a disposable option. Okay, the last step in putting on the PPE is to go ahead and put on your gloves. Make sure they cover the cuffs of your gown. Okay, now you're all set to provide the patient care that you're scheduled to do. And at the conclusion of that, you're going to go ahead and take off your PPE. And the order in which to take off your PPE, it begins with your gloves. So you want to recognize what could be contaminated, obviously the outside of your gloves. So you're going to remove the first glove without touching and just kind of pull it inside out and then hold on to that. Then you're going to stick your finger underneath the other glove and pull that off so you're only touching the outside of the glove. You're going to go ahead and discard. The next step would be to remove your goggles. Now again, you're going to not touch the front of the goggles because that could be potentially contaminated. Take that off without touching and set that aside. Goggles, if you are using them, would have to be disinfected per your organizational's protocol. You would not put these back into your clinician bag until they have been disinfected. Then you're going to go ahead and remove the gown. Now again, recognizing that the gown is potentially contaminated, you don't want to touch the outside. So you go to the back and you want to undo the strings. And then you want to take it off by putting your hands underneath and pulling it basically inside out. So you are not touching the outside of the gown, and you're going to ball it all up and then discard it. Your last step would be to remove the mask. Again, don't touch the outside of the mask, simply use these straps, pull it off, and then this would be discarded. And then, of course, you would follow that procedure as you always do with your hand hygiene. And that completes my demonstration of how to put on and how to take off your personal protective equipment.